And good evening to you. I suppose you're much closer to the seat of government than we are in Johannesburg. Any better insight into what the president is expected to say tonight?
Well, I can tell you, Kathy, that a lot of people are already speculating, and part of those speculation is that there will be a reduced adjusted level or perhaps even a reduced as far as levels are concerned. But this address, Kathy, comes after meetings in recent days of the National Coronavirus Command Council, and there was as well the President's Coordinating Council, and there was also Cabinet. So I would say that there were more recommendations that were made to the President as far as the fight against the coronavirus is concerned, and the president will be unfolding that tonight, Kathy. But of course, and I would assume that the president, in his mind, he'll be thinking that the country recorded 1,447 new cases of COVID at the previous recording cycle, and that, of course, with 157 more deaths, and he will have to do something about it. And we do acknowledge, however, that since the last family meeting, the numbers have since decreased, showing that the peak of the second wave might be just behind us. But what should be worrisome to all of us is that there is a looming third wave if the country has not realized its vaccination targets by the peak of that particular third wave, Kathy. So it is clear that we expect the president to ponder on the vaccination drive as more vaccines touch down here in South Africa. You've seen the J&J vaccines coming through yesterday. So the last time the president addressed the nation in early February, he put South Africa on adjusted level 3, as you rightfully mentioned, announcing beaches and alcohol being unbanned, curfew hours being reduced, and small church services being allowed to operate. So the expectation tonight here is that the president will now announce less strict measures. And at 8 o'clock, Kathy, that particular announcement will be made by the president. Social media as well abuzz that the president might take us perhaps to level 1, if not level 2. But of course, that is only subject to be confirmed by the president when he does speak later on tonight. Kathy?
Of course, any move down to much more eased restrictions will have to come with a great deal of consideration, especially given the fact that our vaccine rollout program has not gotten off with the kind of pace that government would have liked.
Well, it has not really got onto a pace that it is much desired for, and we have seen that while a lot of people are saying that economic conditions and activities must be reopened, Kathy, now there's an issue around whether the people who are going back to work, more of them perhaps back to their offices, who may have been working at home, if they will be vaccinated and if the transmission will be limited, and those kind of informations, Kathy, it boils down now to how can the country really address the issue of vaccinating as much as it can, so that it can really reach that herd population that the president has been talking much about. And only that, through the only way for it to reach that, it is through a rigorous vaccination program that the president should engage all sectors in. We do know that the public-private initiatives have been announced by the president, and he has been saying that there is a need to ensure that that drive comes through. Medical aids coming on board, pharmaceutical companies coming on board, and perhaps even the J&J, when they do finally start to produce that particular vaccine here on South African soil in the Eastern Cape, so that there can be more vaccines and there can be more progress as far as vaccinating the country, so that the more people are vaccinated, it will give us that indication that perhaps we might be in a winning battle, and finally have the economic activities that we've been looking for, and as well as to ensure that people are going to be coming through to a less regulated, perhaps even that level 1. Teachers that are currently having more comorbidities cannot go back to work, so perhaps at level 1 that will allow government to spend less on additional teachers, and those who are home could be able to go back to work.
Philani, let's leave it there for tonight. Philani Pachadi is our Newsroom Africa reporter, and he'll be live at the Union Buildings watching then that address by the president.